Hi, this is Agatha from Block F, and I'll be talking about varicose veins. So, varicose veins are enlarged veins. They're swollen and raised above the surface of the skin. They can virtually happen anywhere in the body, but they usually happen in the legs from the groin to the ankles. And as you can see in the pictures, 4, 5, 6, they can become purple or blue, and they usually look twisted and very gnarly, and so it's not that pretty to look at. So how they occur, um, so the valves in the superficial leg veins, they're supposed to help the blood flow towards the heart, against gravity. But as the person gets older and the valve stops working properly, the blood flows backwards away from the heart because it's unable to withstand gravity. And so eventually the blood, instead of going to the heart, it pools in the lower veins and causing the veins to swell. So other symptoms are pain, achy and cramping in the legs, or heaviness or tiredness, and you might feel burning or swelling, and you might find yourself very itchy. And if you scratch yourself because they itch, you can actually get an ulcer. So you need to be very careful of this. If you see in the picture, like because of the high pressure from the veins in the superficial veins, um, it turned like that. So the people who have varicose veins, they happen more in women than in men. Um, but still, it's quite common in elderly people, and actually not even that elderly. Even my mom has it. Um, and it can be genetic, and it's shown that people with history of um, varicose veins in the family tend to have them more so than people who do not have that history. And if people who are overweight or pregnant, they also tend to have varicose veins because the extra weight in the body, they add pressure to the legs, and it makes it difficult for the veins to move the blood up instead of down. And also people with jobs that have to people with jobs that require standing for a very long time, like such as like waitresses or um, retail sailors, people like that. They have to stand for a very long time, and this too, it disrupts the like blood circulation in the body, and this can also lead to varicose veins. And so some preventative measures are to exercise regularly, and this will um, help the blood flow better, and to avoid standing or sitting or remaining in a same position for a very long time, and to control weight, and to elevate legs when you're resting. And if you find that your varicose veins are a bit severe, you can try using compression stockings to help that. So varicose veins are not life threatening. They can be just very annoying when the symptoms are mild, and you can live with varicose veins um, without a problem. But you should consider getting treatment from a doctor if they happen to become severe, or some people opt to have um, surgery or treatment for cosmetic purposes to look better. But a more severe case is varicose veins. They can develop deep venous thrombosis in rare cases. This is very rare. Um, but if it does happen, the thrombus can embolize and travel to the lungs, and this can be very fatal. But as I said earlier, it's also very rare. So some medical procedures are listed here. The most common practice is sclerotherapy. I'll get into more detail about it in the next slide. Um, so another one is surface laser treatment, and what doctor does is he sends strong bursts of light through the skin into the vein, and this shrinks the vein so that the veins surrounding it will eventually take over, and yeah. This can be quite painful, and you might need to do it more than once. So um yeah. And for varicose veins that are located deeper into the legs, like not superficial veins, but more deeper into the legs, you might need to get endovenous treatment. And what this is, they put a tube into the body. I mean, they put a tube into the vein, and they put a device into that tube, and it heats up inside the vein, and it shrinks and shrivels the vein in a similar way as the laser treatment, and the veins around it take over, and then the veins in the legs function properly soon. And so for varicose veins that are very large, and you might have to get a surgery, and you get a surgical incision in your legs, and with anesthesia, and you cut out the vein that's causing problem. So sclerotherapy is what the doctor does is they inject a liquid chemical with a needle into your vein, and the vein shrinks as a result, and it eventually turns into scar tissue and dies out. Um, this is quite similar to the laser therapy in that you might have to do this more than once to get a desired result. So this was about varicose veins, and thanks for listening. I hope this was very insightful.